after the year's gone by and we go for the initial annual wellness visit, this is more extensive and it builds on the G0402. Now, if the patient never showed up in that year, you would combine part of the G0402 with the G0438. It's because you really are building up quite a database on this patient. So on this visit, you're establishing the beneficiary's medical and family history. You're establishing the list of current providers and suppliers that are regularly involved in providing medical care to the individual. Once again, you're measuring height, weight, body mass index, blood pressure, and other routine measurements deemed appropriate based on the medical and family history. The physician will detect any cognitive impairment, review risk factors for depression, past and present, and mood disorders. And they'll review functionability and level of safety. And then they'll write a screening schedule and a checklist that should span 5 to 10 years. So as you can clearly see, this is not a complete checkup. This is really just an overview and really establishing the patient's medical history. And then the doctor will establish the list of risk factors and conditions, furnish personal health advice and a referral as appropriate to health education and counseling, even like for a mental health provider, anything of that nature. And then any other elements determined appropriate by the Secretary of Health and Human Services through the National Coverage Determination. On the third visit, the subsequent annual visit, the G0439, this one is just basically updating everything from G0402 to G0438, and you're just building and making changes and monitoring and keeping up to date with the new providers, any hospitalizations they may have had, anything like that. And it has nothing to do with 99387, a new physical exam for a patient, or a 99397 established. If you go to the CMS.gov website, you can really see how these visits work and what's involved, and it will tell you that you can bill a medical necessity visit if something happens along the lines, of while you're visiting the patient and there is a health issue concerned. And again, when I say the 99387 and 99397, you can certainly bill that at another time. That will not get paid. If you bill a PAP or pelvic exam with that, they will get paid. And believe it or not, the reimbursement for a PAP and pelvic exam, if you meet the criteria, as well as the PAP smear, the breast and pelvic and the PAP, reimbursement, depending on where you are, is anywhere like from $75 to $80. And so even if Medicare does not pay for the checkup, you're still making decent money on that other part of the exam. And typically what providers do, and Medicare suggests, is that there is an allowable rate linked to the 99387, 99397, and Medicare will pay for the PAP and pelvic or any other lab tests or procedures that are considered allowable for the visit. And you can bill the patient the allowable amount if you wanted to. But usually, when you get to be 65, the patient usually has something wrong with them, and so the doctor has a tendency to use an E&M and then do the screening for the PAP and pelvic. And the rules being with these two codes is that it's every 2 years, but if it's high risk, it can be every year, and there are specific diagnosis codes that go with that. And also be aware of, depending on how you're coding, if it's for the Welcome to Medicare and the annual wellness visits, or the medical necessity or the preventive physical checkups, make sure that you understand about the advanced beneficiary notices that need to be signed and the modifiers that go with that, and know where to link your modifiers like 25 or 59 if that's necessary, if you want to get paid. And the Correct Coding Initiative or any of the websites like supercoded.com, findacode.com will tell you what modifiers are acceptable and what you can and cannot bill with. But again, those G codes have nothing to do with the 99387 or 97, and it is very confusing for doctors, and I think they get it now because it's been around a while, but it was a nightmare in the beginning. They just didn't get it. So, and that's pretty much that. Oh, but I do tell you, there is a beautiful chart on cms.gov that has everything, every preventive visit, every CPT or HCPCS code, diagnosis codes that are associated with it, and how often you can have it. Like, say, a screening for depression is once a year, that type of thing, and it gives you all the information you need. And as long as you have it documented in the medical record, then you should be okay. And that's it. I hope that wasn't too confusing. It is very confusing to even try to bill for it, because doctors usually get it wrong, but I don't know. We'll see.
Do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.